All right, listen up. I'm Dr. Collins. This is the finale. We are tackling the point of no return, Eisenmenger Syndrome. Let's move.
So what is it? Eisenmenger's is the absolute end stage of a shunt that wasn't fixed. You've got years of that left-to-right flow hammering the lungs, causing massive pulmonary hypertension and vascular remodeling. And then it happens. The pressure in the lungs gets so high it exceeds the body's pressure and the shunt reverses. It flips to right to left. The patient turns blue. Game over for surgery. On site, you're looking for the triad: cyanosis, clubbing, polycythemia. That high red cell count means hyperviscosity risks.
Now here's the one rule you never, ever break. If Eisenmenger is in the building, surgery is absolutely 100% contraindicated. You try to close that hole and you will kill the right heart instantly.
Let's go. Now for our mandatory international medical disclaimer. This content is for educational purposes for USMLE and international boards only. It is not medical advice. You must always consult official guidelines and a specialist physician for any and all clinical decisions.
Okay, Sarah, we've spent this entire masterclass talking about those classic left-to-right shunts, your ASDs, your VSDs, but Eisenmenger is the nightmare scenario. It's where we lose that battle.
So walk us through it. Why does the body eventually just flip the direction of the blood flow?
Well, it's really a response to chronic injury, Dr. Collins. The pulmonary vasculature, it's supposed to be a low-pressure system. So when you blast it with high-pressure blood from a VSD for years and years, the little arteries, they remodel. They develop intimal proliferation and medial hypertrophy. Basically, they turn into these stiff, thick, high-resistance pipes. Eventually, that pulmonary resistance gets higher than the rest of the body's systemic resistance. And blood? Well, blood just takes the path of least resistance. It flows right to left through that hole, bypassing the lungs completely.
Exactly. So the very hole that caused the problem in the first place has now become a life-saving relief valve. Now, the guidelines are crystal clear. You do not, under any circumstances, surgically close this hole once Eisenmenger has set in. Sarah, why not? Because if you sew that hole shut, you trap the right ventricle against that massive pulmonary resistance. It will fail instantly.
So for the boards, this is critical. If you see a question with a patient who has a known VSD and they are now blue with clubbing, the answer for treatment is not surgery. The answer is medical management with pulmonary vasodilators like bosentan or sildenafil.
Outstanding. Let's talk about the blood itself. These patients, they often present with a hemoglobin of like 20. What's happening there? That's secondary polycythemia, Dr. Collins. The kidneys are sensing that chronic low oxygen, that hypoxia, and they just start pumping out erythropoietin. This is what drives up the stroke risk from hyperviscosity.
And this is a key management point. We only perform therapeutic phlebotomy if the patient is actually having symptoms from that thick blood. Severe headaches, visual changes. We do not just treat the number on the lab report.
All right, Sarah, let's close this series out. Time for the hyperdrive. High-yield congenital heart disease review in under 30 seconds. You ready? Ready.
Fixed S2 split, ASD.
Harsh holosystolic murmur, VSD.
Continuous machinery murmur, PDA.
Boot-shaped heart and TET spells, Fallot.
Rib notching in an arm-leg BP gap, coarctation.
Blue baby and egg on a string on X-ray? Transposition.
Perfect. Now, let's lock it all in. The final memory anchor. Let's do the chant.
Left to right was the start.
Right to left breaks the heart.
Pulmonary is the high.
Blue is the sky.
No surgery in the end.
Links, review my friend. And that is our deep dive into Eisenmenger Syndrome, a fittingly complex and frankly irreversible end to our series on congenital heart disease. Indeed. Congratulations on completing the masterclass. Join us next time as we dive headfirst into the world of nephrology and tackle the electrolyte storms. Until then, keep studying.